Hey there, welcome back to Midnight Med. This video is on COVID-19. COVID-19 is a coronavirus from the same family as SARS and MERS and causes primarily respiratory symptoms. However, we can see spread and issues in other organs as well. The key clinical features include fever, cough, fatigue, myalgia, increased sputum production, dyspnea, and headache. Now, moving on to the pathophysiology. The spike, membrane, and envelope proteins are the key proteins located on the viral envelope of the COVID-19 virus. The virus gains entry to the cell by the S protein, or the spike protein, binding to the angiotensin converting enzyme 2, known as ACE2, which is primarily found in and around the upper respiratory tract and conjunctiva. Once the virus enters the cell, the nucleocapsid-coated single-strand RNA is replicated and the spread of the virus through the body begins. The virus is typically spread through respiratory droplets through contact with other individuals who are infected with the virus. Those with severe disease are more likely to spread the virus than those with milder forms. The incubation period is generally between 5 and 6 days, and importantly, asymptomatic individuals and those still in the incubation phase can still be sources of infectious transmission. The key clinical features are due to the inflammatory response in the respiratory tract. In severe cases, this can lead to acute respiratory distress syndrome, or ARDS, which is characterized by inflammatory injury, diffuse alveolar damage, hyaline membrane formation, interstitial mononuclear inflammatory infiltrates, and desquamation. The infection can also lead to septic shock and multi-organ dysfunction in severe cases. However, the illness arising from the virus is typically self-limiting, and most cases will recover within a 2-week period. Some of the key risk factors for severe disease or ICU admission include age, so being older, being male, being in a state of immune compromise, having metabolic disease, so diabetes, cardiovascular disease, and hypertension in particular, having respiratory disease like asthma or COPD, and malignancy. The gold standard for diagnosing COVID-19 is a PCR test for COVID-19 RNA. The PCR method is highly sensitive and specific, meaning that a positive result reporting the presence of viral RNA and a negative result reporting the absence of the viral RNA are both generally accurate for diagnosis. However, because PCR testing requires attendance at a testing center, a more convenient method of testing is the rapid antigen test. These can be used as point-of-care tests, and symptomatic individuals can self-administer these. It should be noted, though, that rapid antigen tests have a lower sensitivity, and sometimes an individual may return a negative rapid antigen test result, but a positive PCR test. It is also worth noting that there are different variants of COVID-19, each with a slightly different genetic profile and with slightly different clinical features. The Alpha, Beta, Gamma, Delta, and Omicron variants are the main ones to be aware of. The different variants of COVID-19 can affect the accuracy of the rapid antigen tests in particular. Now moving on to the management. Because most cases are self-limiting, supportive care is the mainstay of management. So with adequate rest, analgesia, hydration, and potentially antipyretics all being of use in managing the symptoms of COVID-19. However, high-risk groups can develop severe disease and may need more extensive treatment. There are antivirals currently on the market for treating COVID-19, with Paxlovid and Molnupiravir being the main direct-acting antivirals currently on the market. These are not used in all, but those who are high risk are generally eligible for them. It should be noted that they may not be equally effective against all variants. Prevention, however, is just as important, if not more important than cure, in the management of COVID-19. Key prevention strategies include social distancing to minimize person-to-person contact, maintaining good hand hygiene to reduce the risk of spreading viral particles between people and surfaces, and wearing masks. N95 or P2 masks are generally used to minimize transmission. A fit test is often necessary to ensure the mask used is the best fit for the individual's face. Vaccination is key to prevention and can both decrease the severity of disease in a vaccinated person while minimizing the risk of transmission should they become infected. The COVID-19 vaccines have been demonstrated to be extremely effective and are the cornerstone of the worldwide effort to tackle the pandemic. Many require regular boosters, so it is important to ensure that you are up to date with your boosters where necessary. Thanks so much for watching. Don't forget to like, subscribe, follow us on Instagram for more, and we'll see you in the next video.